the point about New South Wales is that, as have other states, they've done an amazing job. What we see is that we can manage this. Of all the countries in the world, when you balance the economic and the health outcomes, and I think of it as economic health, mental health and physical health, Australia's doing as well as anybody. You would have Taiwan and South Korea on that front. New Zealand's done brilliantly on the health front, but they've had some real economic challenges. We've managed to strike that balance, and we can do that in Victoria going forward. So we'll work constructively with them, and I think that we can get to a situation where we can operate with some restrictions and with the care of movement and distancing, but in a way which is COVID safe and ultimately will get us through to the vaccine, but allowing the small business owners, the employees to return to what they know, and it will also give us that element of normality in our lives, which is a hallmark of who we are as an Australian community.
New South Wales, as you'd be aware, has had no new cases of COVID for 2 days straight now. According to Queensland, though, New South Wales is still a hotspot. Would you regard New South Wales as still a hotspot, and in particular Greater Sydney?
No, we don't. And there's a Commonwealth definition in relation to 10 cases for 3 days of hotspots. It's vastly below that. It's almost at a continuous zero. You have to presume that there may be individual cases out there and that we need to be vigilant, but New South Wales has been a model in terms of its outcome, as has Queensland. And both states have done very well. And we don't see that there are any Commonwealth barriers. We don't see that there's an epidemiological reason for any borders between those two states. There is progress. Obviously, Queensland has opened up to the ACT after the terrible, terrible case of the young lady who was prevented from going to her father's funeral. Now they've opened up to the border communities, which is welcome. But more generally, outside of Victoria, we don't see that there's a basis for any border restrictions in Australia on epidemiological or health grounds. But there is a real issue on mental health grounds where people are unable to work or see their families or to visit people who may be in palliative care. These are the most deep and human concerns, and we need to be our best selves to recognise that our systems are strong. That's why our results are extraordinary. Our systems are strong, and Victoria's has improved, and so they can, we believe, take safe steps forward which will help improve mental health. And on any remaining borders in the country, we think that the epidemiology in Australia is so strong now that it's a COVID-safe country, obviously respecting the fact that some states would want to keep borders with Victoria for a short period, but in time, very soon, we think there won't be any basis for any domestic borders in Australia.
Okay, Federal Health Minister Greg Hunt.